Invasion of the body by pathogenic organisms. Options are A. Inflammation, B. Infection, C. Sepsis, D. Carrier. The answer is B. Infection. An agent that inhibits the growth and development of microorganisms without necessarily killing them. Options are A. Asepsis, B. Antibiotic, C. Antiseptic, D. Disinfectant. Answer is C. Antiseptic. Infection of the individuals by fine particles of saliva and mucus from mouth and throat of other person. Options are A. Formite infection, B. Droplet infection, C. Nosocomial infection, D. Iatrogenic infection. Answer is B. Droplet infection. An agent that has the power to kill bacteria. Options are A. Antiseptic, B. Bactericide, C. Fungicide, D. Bacteriostat. The answer is B. Bactericide. Invasion and growth of microorganism in a host without causing infection or disease. Options are A. Sepsis, B. Contamination, C. Colonization, D. Culture. Answer is C. Colonization. An agent that inhibits the growth of bacteria. Options are A. Antiseptic, B. Bactericide, C. Fungicide, D. Bacteriostat. Answer is D. Bacteriostat. Environment in which the invading organisms live and multiply. Options are A. Portal of entry, B. Reservoir, C. Portal of exit, D. Environment. Answer is B. Reservoir. The reservoirs can be people, water, and food. Means by which a disease producing organism enters a new host. Options are A. Portal of entry, B. Reservoir, C. Portal of exit, D. Environment. Answer is A. Portal of entry. These are mucous membranes, respiratory system, digestive system, etc. In a patient already suffering from a disease, a new infection set up from another source or host is known as. Options are A. Sepsis, B. Cross infection, C. Iatrogenic infection, D. Contamination. Answer is B. Cross infection. Act of soiling or making impure by contact. Options are A. Sepsis, B. Contamination, C. Colonization, D. Culture. Answer is B. Contamination. Agent that transmits infection from one person to other without showing signs and symptoms of the disease. Options are A. Agent, B. Case, C. Carrier, D. Host. The correct answer is C. Carrier. Immediate disinfection of all contaminated articles and bodily discharges during the course of the disease. Options are A. Bactericide, B. Terminal disinfection, C. Concurrent disinfection, D. Sterilization. Answer is C. Concurrent disinfection. The disinfection of the client's unit at the end with all the articles used by the client upon his discharge. Options are A. Bactericide, B. Terminal disinfection, C. Concurrent disinfection, D. Sterilization. Answer is B. Terminal disinfection. The entry and multiplication of a disease producing agent in the body. Options are A. Asepsis, B. Infection, C. Inflammation, D. Injury. Answer is B. Infection. Separation of infected persons from the non-infected persons for the period of communicability. Options are A. Quarantine, B. Isolation, C. Reverse isolation, D. Contamination. Answer is B. Isolation. Isolation of well persons for a period of time equal to the longest incubation period of the disease. Options are A. Quarantine, B. Isolation, C. Reverse isolation, D. Contamination. Answer is A. Quarantine. Destruction of all microorganisms, including their spores. Options are A. Immunization, B. Terminal disinfection, C. Concurrent disinfection, D. Sterilization. Answer is D. Sterilization. Act of creating immunity artificially against a particular disease. Options are A. Sterilization, B. Disinfection, C. Immunization, D. Isolation. Answer is C. Immunization. Orange discoloration of body fluids is seen with options are A. Isoniazid, B. Ethambutol, C. Streptomycin, D. Rifampicin. Answer is D. Rifampicin. 8th, cranial nerve damage is a serious complication of options are A. Rifampicin, B. Ethambutol, C. Pyrazinamide, D. Streptomycin. The answer is D. Streptomycin. Mebendazole is an options are A. Antibiotic, B. Antiviral drug, C. Fungicide, D. Antihelminthic. The answer is D. Antihelminth. Antihelminthics are drugs that treat parasite worms infection in humans and animals. Pain associated with autonomic nervous system changes. Options are A. Chronic pain, B. Acute pain, C. Visceral pain, D. Referred pain. Answer is B. Acute pain. A narcotic analgesic. Options are A. Paracetamol, B. Acetaminophen, C. Acetyl salicylic acid, D. Morphine sulfate. Answer is D. Morphine sulfate. Antidote of morphine is options are A. Protamine sulfate, B. Naloxone, C. BAL, D. N-acetylcysteine. Answer is B. Naloxone. Important cation of ECF, extracellular fluid. Options are A. Sodium, B. Potassium, C. Calcium, D. Chloride. The answer is A. Sodium. Important cation of ICF, intracellular fluid. Options are A. Calcium, B. Potassium, C. Chloride, D. Sodium. Answer is B. Potassium. Compounds composed of amino acids. Options are A. Carbohydrates, B. Fats, C. Proteins, D. Minerals. Answer is C. Proteins. Amino acids are the building block of proteins. Energy yield from carbohydrates. Options are A. 4 kilocalorie per gram, B. 6 kilocalories per gram, C. 9 kilocalories per gram, D. 7 kilocalories per gram. The answer is A. 4 kilocalories per gram. The carbohydrates, protein, and fats are known as macronutrients, and the energy yield from these macronutrients are shown here. From the protein, it's 4, from the fat, it's 9, and from the carbohydrate, again, it is 4. Marasmus is options are A. Protein malnutrition, B. Protein energy malnutrition, C. Vitamin deficiency, D. Deficiency of fatty acids. Answer is B. Protein energy malnutrition. Histamine and related compounds are responsible for options are A. Hypovolemic shock, B. Cardiogenic shock, C. Anaphylactic shock, D. Neurogenic shock. The answer is C. Anaphylactic shock. Warm, dry, pink skin is seen in options are A. Hypovolemic shock, B. Cardiogenic shock, C. Anaphylactic shock, D. Neurogenic shock. Answer is D. Neurogenic shock. A drug used in shock. Options are A. Mebendazole, B. Dopamine, C. Acyclovir, D. Isoniazid. Answer is B. Dopamine. Infection in a client that was not present or was incubating at the time of admission to the hospital. Options are A. Fomite infection, B. Droplet infection, C. Nosocomial infection, D. Iatrogenic infection. C. Nosocomial infection. under pressure sterilization is also known as? Options are A. Disinfection, B. Pasteurization, C. Autoclaving, D. Incineration. Answer is C. Autoclaving. Best method used for disinfection of milk. Options are A. Boiling, B. Pasteurization, C. Autoclaving, D. Desiccation. Answer is B. Pasteurization. Removal of microbes from liquids by means of porous materials. Options are A. Desiccation, B. Boiling, C. Pasteurization, D. Filtration. Answer is D. Filtration. Drying method used in food preservation. Options are A. Boiling, B. Pasteurization, C. Autoclaving, D. Desiccation. The answer is D. Desiccation. Enteric isolation is indicated if the transmission is by A. Respiratory route, B. Fecal-oral route, C. Parenteral route, D. Sexual contact. Answer is B. Fecal-oral route. Drugs given for the prophylaxis of rheumatic fever. Options are A. Cephalosporins, B. Aminoglycosides, C. Penicillin, D. Tetracyclines. Answer is C. Penicillin. A third generation cephalosporin. Options are A. Cefazolin sodium, B. Cefepime, C. Cefoxitin, D. Cefotaxime. The answer is D. Cefotaxime. And you can see the other examples of third generation. Ototoxicity is seen with options are A. Tetracyclines, B. Penicillin, C. Aminoglycosides, D. Chloramphenicol. Answer is C. Aminoglycosides. Gray baby syndrome is seen with the administration of options are A. Tetracycline, B. Penicillin, C. Aminoglycosides, D. Chloramphenicol. The answer is D. Chloramphenicol. Redneck syndrome or red man syndrome is a side effect of options are A. Streptomycin, B. Vancomycin, C. Chloramphenicol, D. Tetracycline. The answer is B. Vancomycin. The syndrome is a non-allergic reaction marked by flushing, erythema, and pruritus within seconds or minutes of vancomycin infusion. Peripheral neuritis is an adverse effect of which of the anti-TB drugs? Options are A. Isoniazid, B. Ethambutol, C. Streptomycin, D. Pyrazinamide. Answer is A. Isoniazid. There are many reasons why people get peripheral neuritis, but among this, the anti-TB drug isoniazid can have the adverse effect of peripheral neuritis. If you like the video, please like the video and share with your nursing friends. And don't forget to subscribe the channel Nursing Exam Insight, your ultimate resource for all nursing exams. Thanks for watching.